Hello, I'm Bergeret Galley. I'm a French plastic surgeon from Paris, and I will talk today about periorbital rejuvenation without surgery. These are my disclosure. I have no financial interest with any company and any product, which is rare in fillers. When we talk about periorbital rejuvenation without surgery, I will emphasize and focus on filler treatment. And of course, we could have had some laser therapy, some peeling therapy, but I will not enter into this debate. I will focus on fillers for periorbital rejuvenation. What do we do with filler? We do rejuvenate the skin, and we do also add some volume to restore the volume in the lower lid and also in the upper lid. Due to an anatomical reason, it is a difficult region to treat, even with good indication and knowing exactly how to select your patient. On these photos, you will see the consequences of aging, the aging alteration, and you can really immediately notice on the lower eyelids the loss of fat volume in malar region and the loss of definition of the orbital contour. We also have to suffer an elongation of the lower eyelid, septum relaxation and fat pad protrusion, and formation of dark circles and tear trough. All of this is due to anatomical modification, and you might notice and read the orbicularis retaining ligament become lax, allowing orbital fat to protrude, while zygomatic ligaments stay strong. Then the suborbicularis ocular fat will be protruding and sliding. Possible technique for correction: surgery, fat grafting, non-autologous fillers, periorbital laser resurfacing or deep peeling, and of course the combination of all of this. This is an ideal patient for my technique, rejuvenation of the orbits with fillers. A patient with deep lower eyelid depression and tear trough. She doesn't want surgery. This is a female for this time, but men are also candidate. Skin is not too thin, and eyelids are not too puffy. This is really essential, because if you treat people with too much deformation and skin alteration, it won't work. My technique is a two-stage technique. First stage is a botulinum toxin treatment for the frontalis, corrugators, and orbicularis. It allows muscle relaxation and later more precise placement of the filler in the lower eyelid. It allows you also in the same time to provide some volume restoration of the malar region. Most of the time this is mandatory. This is this patient with multiple points of injection, some more concentrated Botox, some more diluted Botox, or botulinum toxin, or Azalure, or whatever you are comfortable with. And then if you can, let's pass 8-10 days, you start with the second session of the treatment. Of course, this is ideal, but most of the patient wants an immediate and effective result, and it's not easy to give that, but if you can, it's better in 2 stages. In the second stages, then you will deal with fillers, and you will treat the orbital rim and tear trough. Patient is sitting, head is upright, you will see on the video. Patient is asked to look down and up, this is very important, eventually laterally, to identify the exact location to be filled, the exact location of the fat pocket. And I use most of the time a vertical multipuncture injection technique directly on the bone, it means the periosteum, or using the oblique technique less frequently, and I use, of course, small needles, 30 gauge or 32 gauge if possible. If oblique injections are necessary, the index finger is placed slightly inside the orbital rim to control the injection. I think it's safe. What should you use? This is the most important impact and aspect of the periorbital rejuvenation without surgery. We need to use a hyaluronate, so hyaluronic acid, but as much as possible pure, cross-linked, not too thick for small needle, and to avoid hypercorrection. And the ideal is a medium concentrated and cross-linked hyaluronate, well purified. A filler you know very well. Don't do the experimentation for the lab, and I give you a few examples. But you have so many good hyaluronate now, though. You need to use one you are comfortable and one you know specifically. You see the patient, the type of improvement we are doing. Of course, it's a sort of camouflage, but it gives good treatment. It's ideal for patients who don't want to have any downtime for surgery. This is my video. Now I will show you how I deal with the treatment. Doesn't want to go. Yeah, maybe you might not benefit from the video. Doesn't go. No, let's keep. Well, I wanted to show you how video is not downloaded, right? Okay. Yeah, it was done. Okay. Let's keep again. Okay, I show you on me now. Instead of injecting a patient on a relaxed position, you have to put your chairs in a way that the patient is half seated. It's very important, and that the head is upright. So put a pillow under the head and ask your patient to be straight with the chin, and then look down and up and laterally, so you see exactly the deformation you have for the tear trough and all the depression of the lower eyelid, and that's exactly the same for the upper eyelid. The upper eyelid is it's a region which is even more difficult to treat, but it's feasible. But of course you need to stay below the orbital rim, but just on the bone, just on the periosteum, because you don't want, especially with filler, it's different from fat, you don't want to have any vascular traumatism. You see the patient before and after. This is really good and ideal camouflage, and for somebody who doesn't want to have surgery, it's a good alternative, and it makes people hold and stay in your clinic. Again, on the profile view, a lady before and after. You can see this is a very good case because she also have an improvement of the pigmentation. This is rare. Most of the time filler are not improving the pigmentation, but on some dark circles it helps, and you can see that in this time it was effective. Men are candidates for this technique. Many men are still afraid of surgery, and it's a good way to keep them in your practice. Another candidate, younger, good indication. A lady, global facial enhancement with filler and botulinum toxin. You can see about the relaxation. When you give fillers and Botox, and especially in 2 stages, you can really achieve a good improvement of the face. Relaxation, less tired, more younger. Full facial enhancement with fillers and botulinum toxin, no peelings, no surgery. Good result, but less evident. She looks also sad, and it doesn't improve, but anatomically it's better. Full facial again. Full facial again, and you can see how the 2 stage is important to give the relaxation and the ideal placement of the fillers. Also on perioral indication. This is difficult cases when women or men have already had extensive surgery of the eyelids, and you absolutely don't want to redo a surgical procedure. Though what can you do? You can do camouflage with filler. This is a decent result. Another result. And really, we are talking really about camouflage. Full face. Okay, to conclude, what is it important? Technically, the volume augmentation of the deep plane of the malar bone and orbital rim is enough to hide the crease and fat pad protrusion. You need to avoid overcorrection or irregularity, which create lumpiness and local edema. It's very important also that you need to be careful with your injection. You use retro-tracking injection, but always in small quantity and always controlling exactly where you do the implantation of the filler. You don't inject superficially except as a touch-up with a very light density hyaluronic filler or non-reticulated fillers, hyaluronic acid filler, and always suggest a touch-up, less is more, and don't do too much at the first time. Things not to do or to avoid superficial implantation, collagen. I think nobody now is injecting collagen, but we see some patients with collagen sometimes. Too dense implant or non-resorbable, definitely slow resorbable or non-resorbable implant, they absolutely should never be injected in periorbital region, and this type of skin, it's too fragile. Bad selection of the patient, eyelid too puffy and ptotic, skin too thin, or patient expectation too high. Potential complication, you might have everything, also lose one eye's vision, but most of the time you have irregularities, swelling, visibility of the implant, and dark circle pigmentation and blue coloration, tintol effect. You might have granuloma, and of course you might have more complication. This was very interesting because it was a filler which was commercialized in France and dedicated for periorbital region. It was a very big mistake because calcium alginate has a high tendency of giving granuloma, and this patient had a lot of swelling. This is a patient, she came before and then she went somewhere else to do some more enhancement, and then you can see where with Novabel. Novabel was really a bad implant. Fortunately, it has been removed since a long time now, but you see the patient looked puffy, and this was accentration of the blue coloration and edema under the lower eyelid, and we could really treat only with some light dose of hyaluronidase, even if it's not authorized. And this is another patient. This is very light complication, but when they have this type of complication, they are not happy. It's a very good hyaluronic filler, and you can see how this patient looks puffy. The treatment of this type of complication is no more excision. You might give hyaluronidase and eventually corticoid in situ injection. So in conclusion, non-autologous injectable fillers are useful to correct tear trough and aging eyelids. For patients who cannot afford any downtime, so they don't want to stop working, or surgery or microfat injection, I love the fat as a full face enhancement. I think facial lipofilling is great, but if you want to treat a patient in 30 minutes in consultation, you're not going to inject fat, you will inject fillers. Periorbital region, it's a delicate zone, even for surgeon, and you need a well-known, good filler, essentially a hyaluronate and a precise technique, and always better less than too much. Thank you.